When and if you need to worry about your symptoms, that's what we're covering today. And here's a question about pediatric fevers from Cristal in Woodland Hills, California.
Hi, doctors. I get really worried when my kids have a fever.
Hey, buddy. How you feeling?
I don't feel that good.
Ooh, you feel hot.
My son recently had a temperature of 104, and he was speaking gibberish. His eyes were glazed over. I was wondering, when is it okay to wait for the Tylenol or Motrin to kick in? And at what point should I actually take him to the hospital?
We have Cristal here with us today in the audience. And you know what? You are like many moms out there. Pediatric fevers can be one of the most confusing things for a mother.
It's probably one of the biggest calls I get. But let's talk about really what a fever is in the first place. First off, if you take a look at this, the normal body temperature is an average of 98.6. But that's really an average. It could be a degree higher or a degree lower and still be in the normal range. We don't really call it a fever until it hits 100.4. All right, and then over that, we call it a fever. Now, when do you start to worry? Is it 102, 103, 104? That really depends on how the child's acting. If they're 103 running around, I don't worry about it. If they're 101 and tired and lethargic, then yeah, I do worry about it. Now, parents want to know, when does the fever really get dangerous? Brain damage, when does that ever happen? And it has to be really high. Like I'm talking 107, which is a really high fever, and that's really rare. I don't even know if I've ever seen a fever that high in a normal child. So brain damage from fever in itself, unless it's that high, usually not a problem.
In the end, as a parent, it's not what's the number, it's how is my child doing. And when you get calls from parents, and they inevitably will call and say, my child has a fever, what is the first question you ask?
I ask, what is he doing? And sometimes the answer, he's jumping on the bed. I say, all right, talk to you in the morning.
Thank you so much, Cristal.
Thank you.